Well, I'm Leah Hughes with Mountain Roots Holistic Healthcare, and welcome to the group fleet. Oh, I can't even talk today. Excuse me. Welcome to the weekly group visit. And today I'm going to go over ozone. Any of you who have been to my clinic or talked to me know that I'm a firm believer in ozone and what it does for the body. I do use ozone in our clinic, and I also advocate for those of you, especially with chronic illnesses, for utilization of home ozone. So if you have any questions about that at the end, we can answer those for you as well. So I'm gonna kind of get started here. I was working on the slideshow right before we started, so bear with me as we go through these. So ozone does not act like a drug. It's actually what we call a biological modifier. So it activates your biological systems to help you optimize your health, regenerate tissue, and prevent disease and help reduce disease in many ways. And you'll see this in the following slides as we go. So many of you have heard of ozone, our layer of the earth. 90% of the Earth's ozone is formed when the sun's ultraviolet energy hits oxygen, which is what our Earth is made up of. The remaining 10% of the ozone layer is actually generated by the lightning storms in Venezuela, which I think is super cool. And this is actually the ozone that you think of. The ozone layer is the same ozone that we're talking about using for medical applications here. So ozone is kind of oxygen molecules, and you're going to see here it's 3 molecules, but it works by utilizing oxygen, like helping oxygen work better at your tissues. So with oxygen, it's not just what you take in, what you're breathing, but it's how it gets into your body, into the system, and how your system actually makes that effective for all the different processes like energy and healing that you need. As we age, we don't effectively utilize oxygen. I think we all know that kind of as we age, things don't quite work as well as they did when we were in our 20s, although we wish they would. And kind of the key treatment and prevention of disease really does boil down to how your body uses oxygen. Decreased oxygen utilization can happen locally and it can happen systemically. Systemically meaning your entire body. So this is a little picture of your cell here and how oxygen gets utilized by the cell. So you see the oxygen over here on your left. The lungs, heart circulate that oxygen into the cell. And in that cell, fat, glucose, thyroid nutrients, cortisol, toxins all get affected by that. And it uses that oxygen to feed the body. And once it does that, it actually produces what we call free radicals. So what are free radicals? Well, they're kind of like unstable molecules. It's like they're looking for a dance partner. So if you ever think way back, I know this is super hard, high school chemistry, where you had like 3 and 2 and you had to put them together and everything had to equal on one side and on the other side. That's what these free radicals are looking to do. They don't really like to be out there all by themselves. So they're missing an electron from their outer shell and it makes them unstable. So they want to go steal that dance partner from other molecules in your cell, from your blood, just literally anywhere they can get that. And that is actually what causes the damage to the surrounding cells. So I wanted to put this in here and make sure you guys understood that, because I think sometimes even in commercial advertising and things like that, people kind of throw around the words oxidative stress and free radicals. And it's kind of like, You think you know what that means, but you're not always sure. So think about that as you're dancing and you're looking for a partner, and you're going to take any partner you can. And that partner, when you take him, is going to take something away from something else, causing a bunch of damage. So here we've got oxygen utilization. What does that do? It supports organ function. It helps with your senses, meaning, your taste, your smell, helps with repair and all aspects of your body. Actually, your thoughts affect oxygen utilization, reproduction, digestion, your hormones. So that's why when you come to see me, and here at Mountain Roots, we really believe in that holistic approach. We're looking at your hormones in all these different aspects, including elimination. So hypoxia is actually the word for lack of oxygen. So hypoxia generates excessive free radicals. Remember us talking about that and how that causes damage. It also deprives the cells of its ability to repair, take care of the cell's outer membrane, and its ability to produce antioxidant enzymes. The combination ultimately destroys the mitochondria. The mitochondria is the center of the cell. We call it the powerhouse. It's the conductor. It makes everything work appropriately in the cell, ultimately in your whole body. So you will hear a lot of people talk about mitochondrial damage or disease states. A lot of disease states really boil down to how well is that mitochondria functioning. So decreased oxygen utilization causes functional hypoxia. So it's kind of the metabolic equivalent of not having enough oxygen. Think about when you're breathing and you've been short of breath before and you just can't get that in. That's kind of what's happening at the cellular level. So what causes that oxygen decrease in that oxygen utilization? So you just heard me kind of talk about the mitochondria. So there's pre-mitochondria factors and mitochondria factors. So things like decrease liposis, which is the breaking down of fat. And I know weight loss is like a big topic these days with all the weight loss medications. So we want that to happen. Hypoglycemia, which is low glucose, restriction of the blood supply to the tissues, poor oxygen delivery, and inflammation. The mitochondria factors that cause decreased oxygen utilization are things like toxicity, infection, stress, nutritional deficiencies, hormones, decreased methylation, lack of fitness, and there are many medications that will do this to you as well. So here's kind of just a little diagram that shows here in the center, we have that mitochondria decay because of that decreased oxygen utilization, causing those free radicals and also causing a reduction in the things that actually bounce out those free radicals. Thus, what is the ultimate thing that happens? We have degenerative disease and we have aging. So ozone works on that oxygen utilization to support the tissues. And so we're going to talk a little bit about what is medical ozone. So it is pure oxygen. And you'll see that a single oxygen atom cannot exist alone. That's why the O2 is two oxygen molecules together, and that's what makes it stable. Ozone is actually O3, three oxygen atoms sharing the electrons, and it is a slightly unstable molecule, but this is why it does all these powerful things that I'm going to talk to you about in the next coming slides. So when we're not utilizing that oxygen, we're going to have all these negative effects. And what the negative effects actually cause is something called decrease in your NAD/NADH ratio. So what is NAD? And please forgive me for massacring this because I know I'm going to. Nicotinamide adenine dinucleotide. So it's a coenzyme of a molecule. It is found in every living cell of your body. We have the most of it in our 20s and it declines with age. And it plays a super, super important role in helping you have energy to do things and maintaining that cell to work the way that it's supposed to. So it really does affect our mitochondria. And it's kind of the mitochondria is the power plant in our cell for our food and energy and how we get that energy and turning that over. So it's so effective for these diseases because it normalizes the ratio. And the ratio that we want is 701. I know that's probably not important to most of you, but I wanted to make sure you guys had this information. So decreased oxygen utilization is really what boils down to why we have disease. And the treatment of all diseases, including things like autoimmune disease, cancer, can be improved or even reversed when we can enhance oxygen at the tissue level, when we can give better oxygen to the cell and the cell can actually use it in a way that it needs to and that it's programmed to. So this is why ozone therapy can be used pretty much on every person you know, from diseases to enhancing aging. The most effective way that we maximize the ozone therapy is actually when we combine it with other therapies, and those therapies should be focused on eliminating the causes of that decreased oxygen utilization. So we do believe that, ozone is not necessarily a standalone therapy. We want to use it in conjunctions with a lot of other things, such as working on diet, working on detoxification, getting those heavy metals and PBAs and all those chemicals that we hear and we talk about every day. Also stress control, decreasing coffee, alcohol, making sure we're getting exercise, sleep, regulating our emotions, dealing with allergies, working on sugar consumption. So ozone characteristics, medical versus commercial. So we use oxygen, and a lot of you, I do advocate for the home oxygen, and pretty much oxygen is oxygen. And when we're getting you ready to use home oxygen, sometimes it becomes very difficult to get medical grade versus commercial grade. And so I just really wanted to go over what the differences of those are. So it's not actually the quality of the oxygen. The oxygen is the same. It has to do with the custody of the oxygen tank. So when a welding tank is used, they rotate it or swap it out. You don't know if the tank's been left open, if there's any contaminants that enter the tank. And that's what really contaminates the oxygen, not what they're putting into it. So the solution that we use when we're trying to get oxygen for home ozone, and we're looking at possibly using commercial oxygen, is you as a consumer want to buy your own oxygen tank, tag it in some manner, and when you take it to get filled, you now have a chain of custody. And so you're going to make sure that the oxygen tank that you gave them is the one that you're getting back. And that is what's going to prevent you from getting any contaminants into the oxygen. And that is why it is actually okay for you to use commercial grade oxygen with your home ozone machines. Now, I will caveat that with telling you that I do use medical grade oxygen, but I do the exact same thing. I have my tanks in my clinic and I take them to the oxygen supply company. They literally fill it up for me right there. And then I take the same tank home with me, thus preventing any contaminants going in there at any avenue. So characteristics of ozone is it is one of the strongest naturally occurring antioxidants or oxidants. Its half-life is 45 minutes in glass and 30 minutes in plastic. It does require humidity. It does not deplete the body of any nutrients. And a lot of people get worried. They've heard, oh, ozone is really bad for your respiratory tract. And so I put this in there because it's only a toxin at 0.15 to 0.25 parts per million, and that is with chronic exposure. So it is not toxic to the respiratory tract if you can smell it, if you can't smell it, or if your exposure is very limited. So contraindications, G6PD deficiency, that is a genetic blood deficiency. When you come and we talk about using ozone, especially if we're going to be using high dose ozone. And that's why this is kind of a modified contradiction, because it really, the contradiction is when we use the higher doses. But I will test you in the clinic. And if you do go to someone else to obtain ozone therapy, most likely they're going to ask you if you've had a G6PD or want a copy of that or want to get that from you. Hyperthyroidism, definitely a hard contradiction. Active seizure, of course, we don't want to give anybody a treatment like this if we need to be dealing with the active seizure. Cardiac or cardiovascular instability, meaning like MI, hemochromatosis, acute alcohol intoxication, an active heart attack or an active stroke, thrombocytopenia, and then patient who are receiving treatments with iron or copper. So the published effects of the ozonides are actually what forms and connects to the tissue and what is actually helping you heal. So it does serve as antibacterial, it's antifungal, antiviral. There's no resistance in the use of it. It does enhance the use of chemotherapy and radiation when we're using it to treat cancer patients, and it activates NRF2. So NRF2 is your master regulator of your cytoprotection. So NRF2 actually increases your ability to detox. It helps the production of phase 2 enzymes. These are enzymes that are responsible in supporting detox at a cellular level and also in your liver. It enhances the stability and turnover of the proteins in your body. It's going to reduce inflammation, protects against neurodegeneration. We all want to keep that brain functioning. It has an anti-tumor effect. It promotes cell death and longevity. So the safety of ozone. Is ozone safe? So in this study, they actually had over 384,000 patients treated at the rate of 14.5 treatments per patient. So you see that it's about a little over 5.5 million treatment sessions. And this is with IV ozone. And the complication rate was 0.006%. So very, very, very low. Just to put that in perspective, the complication rate of using a common antibiotic in the family of fluoroquinolones has a black box label of causing tendon rupture, and that complication rate is way above 1%. So when we're thinking about safety, ozone is very, very safe. So ozone can be used in treatment of chronic infections. One of the most important clinical effects is that it can actually cure some chronic infections. We do believe that it can be used as a monotherapy or in conjunction with antibiotic therapies or other therapies as well. When we're looking at the layers of the immune system and how that works, we have these humoral system antibodies, cellular mediated immunity, and non-specific mediated immunity. The non-specific, that is kind of where things go haywire. That's like that primitive system. It doesn't recognize what's going on. And it's just going to kind of be like, okay, I have all these things to utilize in my body, and I'm going to throw the kitchen sink at that. So when we treat chronic infections, We have an acute infection. Um, and in acute infection, ozone can help kill the microbe and can cure you of the infection. So think of it working kind of like an antibiotic that you take when you go to your primary care physician and you have some type of infection in your skin or a lung infection or a bladder infection. In chronic infections, though, and that's kind of why showed you the slide before, we're not actually trying to kill the microbe. We're actually trying to balance the immune system, because why it becomes chronic is because the immune system has gone haywire. The immune system imbalance can start, and it often starts in that acute infection. And this is what leads to chronic infection, because the immune system was like, hey, buddy, I don't know what to do with this for a lot of reasons, genetic, overwhelming the system. And that's why it continues and continues and continues and continues. So ozone therapy can correct that imbalance by manipulating the cytokines, which are these chemical mediators that are released by the immune system as a result of the chronic infections that causes that circle and circle and circle. And if you heard me talk about chronic inflammatory response syndrome, or CIRS, this is kind of what happens in that process. So how do we administer ozone therapy? There are actually a lot of different ways. So major HT or MAH, that is IV ozone. That's where we're actually going to draw your blood out. We're going to inject that ozone gas into the blood so that your red blood cells actually attach to the ozonites, and then we're going to infuse that back in your body. Key ozone, that's using chelation with ozone. We also do rectal insufflation. We basically fill a bag up with gas and we inflate that into your rectum. Limb bagging is when we bag your area for things like wound infections, and we allow the gas to flow in there. Prolozone is where we use ozone to inject into the joints to heal them and reduce inflammation. We can use it in the ears. It has amazing results for hearing loss. We also infuse it into the bladder. We can do ozonated water. So ozonated water is great for washing on wounds. We can ozonate normal saline, like the saline bag that you go to get rehydrated with. We use oils, injections. You can also find ozone saunas. There is inhaled therapy, and we can use it as a vaginal insufflation, filling the vaginal vault up. So when we're thinking about we're going to do ozone, how do we want to prepare for that? We want to be well hydrated before every treatment. It's always a good idea to eat. We do want to kind of minimize and avoid taking some vitamins and minerals before each treatment, and be ready for vasovagal restriction. What is a vasovagal restriction? That is you passing out and getting lightheaded. So we just want to prepare for that. That's going to be more on the side of the clinician who is taking care of you and getting ready. And these usually happen when we're coming at you with a needle to poke you with an IV. We don't usually typically see any of these when we're doing insufflation therapies, or when you're doing them at home. So I touched on this a little bit, but major auto hemotherapy, MAH, this is IV ozone. It's the primary method that we get ozone into your systemic and vascular system. I touched on this. Blood is withdrawn into a bag or bottle containing an anticoagulant, such as heparin, if you've heard that before. We do use calcium or glutathione added to the bag, and this enhances how ozone works and affects on the cytokines. Ozone is then injected into the bag so that it is touching the blood. And when we do this, we'll see the blood, which is not oxygenated. When we pull it out, you've already used the oxygen in there. That's why your blood is dark red. And when we inject the bag with the ozone, you'll see it turn bright red. And if you remember from the beginning, we were talking about how ozone works on oxygen utilization. So think Bright red, good oxygenation. And then the treated blood is actually returned to the patient. That because we return the blood to the patient and we take it out, that's why we use that anticoagulant for you. Now, we're not anticoagulating you as a patient. We're just giving you enough of that to make sure that we don't have any clots forming in the bag that could affect or have a negative effect on you. So I'm going to go over some of these things that we do with ozone. So intestinal insufflation. So this, we usually use a small, thin plastic catheter, maybe a syringe. Sometimes we use bags. You can find these online, and we fill the bag or the glass container or even a syringe with ozone, connect it to the catheter. We insert that into your rectum and we inject that slowly into your rectum. So we do that over 1 to 2 minutes. It's best, although not completely necessary, to do this after you've had a bowel movement or an enema. And if there's any rectal irritation or abdominal discomfort, we can decrease the amount that we give you, or here it says micrograms per ml. That's the concentration of the ozone that we give you. Ozone can be a little irritating directly to the tissue, so some people will have burning. So ozone oil, I think ozone oil is fantastic. And if you ask my husband, he literally thinks it's the best thing. He actually came home the other day and told me that he was at the grocery store and there was some guy looking for Neosporin, and he had a whole conversation with the guy in the grocery store. Yes, this is my husband. He talks to strangers about how he shouldn't waste his time on Neosporin, and that has he ever heard of ozone oil? Yes, that's my husband. My husband has found that ozone oil works for literally everything that he wants to do. He will put it on his acne. He will put it on any scrapes, cuts, anything that he has. It is great for skin lesions, great for wrinkles, great for infections. You can use it in the mouth. It's great for things like herpes outbreaks. You can actually even orally digest it to help treat things like H. pylori and infections in the gut system. We can also apply them to the vaginal area and the rectal area. If you get on, I use a company called Pure O3. They have a whole dental system, and ozone is great to help reduce inflammation in the oral cavity. If you see a biological dentist, I have a great one in town. He actually will use ozone to reduce inflammation, and they can even make you ozone dental trays to help treat periodontitis. You can also put it in your ears. Typical dose is 1 to 2 times per day. And I will tell you, if you go and you're checking out ozone oils, because you heard me talk about how my husband thinks this is the bee's knees, you will find that there are different types of oils. So they do a sunflower oil, a hemp oil. They also do coconut oil. And basically the concentration, or how strong the ozone dose is very dependent on the type of oil that the ozone is infused in. So your stronger ones are going to be sunflower and hemp, and then your more weaker ones are just not as strong, are going to be jojoba or coconut. And kind of think about, what you're using it for. Coconut oil is solid at room temperature, so it's a little bit easier to apply, less oily. That sunflower oil, they also have olive oil. You know what that is. It's oily. So when you apply it, it's going to be a lot more oily for you. But depending on what you're applying it for. And also, let me tell you that I am highly allergic to mosquito bites, and I have never found anything that works when I get a mosquito bite. And if I put ozone oil on my mosquito bite and go to bed, it is gone the next day. Before, I would have a red mark. I'd be itching for like 7 to 14 days. So if you live in an area where the mosquitoes are prevalent, try ozone oil to see how that works for you. So we also use ozone gas, and we call it vaginal insufflation. You can use it for vaginal or cervical infections. We also use this for infections in the vagina and viruses that you can have in there. Usually you're lying down. We insert that catheter into your vagina. We run the ozone gas at a concentration of around 10 micrograms per ml. And you can actually do this 1 to 2 times per day for about 5 to 10 minutes. And when this says there might be some ambient ozone, there's going to be ozone gas. It's kind of going to spread in the area. You're going to smell it slightly. Don't stress about it in your lungs. But I do encourage, when we do these, we like to use fans or open a window or just a well ventilated area to protect you. So we also use it in the ears, and I mean, it really, really can reverse hearing loss. It's kind of crazy. Also for ear infections, and it will, questionable whether how much of that actually gets into your bloodstream. Um, this says a muffler to decrease the noise, because the ozone generator actually generates noise, and we don't want to harm your ears from the level of noise that we use. When we first started doing ear insufflation, we used to use kind of like a stethoscope type device, and often we would put a little bit of saline on some 2x2s and put those in your ears to kind of help muffle and keep the ozone humidified for you. Now they look like these the boys earphones, kind of the round ones that go on your ears, that will help muffle it a lot better than kind of how we used to do it in the old time. But usually we're going to run that around 10 micrograms per ml at 1/8 of a liter per minute. And you can treat 1 to 2 times per day for 5 to 10 minutes. And it's not a bad idea. We talked about this just in the last slide. A fan in the face kind of helps blow that any excess ozone away from your breathing area. So I know this slide looks a little complicated, and this is some efficiency ratios. So I will talk to you in the clinic about doing home ozone, doing the IV form versus rectal insufflation, and why I think that that's a great idea, less invasive, no needles. And that is because it has to do with the improvement versus no improvement. So, ozone saline has an efficiency ratio of 1.34. MAH, that's an IV form, we're looking at 2.2. And if you look at this rectal right there, just below the efficiency of the IV form, and then sauna as well, not too far behind. So there's lots of ways that you can utilize ozone, and you can actually even utilize it in your home without having to come to the clinic. And it does get really expensive to do multiple treatments, especially when we are treating a disease state. And often I'll talk to clients about it is an initial investment, but if you divide that over time, you're actually going to save so much money that you can use in other aspects of your life or other aspects of your treatment. So the applications, what do we treat with this, right? Like I just told you, it gives you oxygen utilization, works on the cell, went into some crazy detail about the cell that you guys probably are like, I don't need to know this. But why do we want to use this? Because it has evidence to support that it reduces these things or helps heal these things. So coronary artery disease and cardiovascular disease, gangrene, macular degeneration. Now, I have treated patients with ozone who've had macular degeneration, and I have sent them back to their eye doctor without telling them what we're doing and without the patient telling them what they're doing. And the eye doctors literally will be like, oh my God, I'm seeing reversing, significant reversing. What are you doing? And the patient says, I'm doing ozone. So if you have a risk for macular degeneration, you have that in your family, or you are suffering from it, this is a really, really great way to stem off the effects of that. It's super great in reducing aging, because what is aging? Aging is the decline of the utilization of oxygen in your cells, and that's why ozone is great for that. It helps with chronic fatigue, really great for cancer treatments, super great for treating acute infections, chronic infections, funguses, interstitial cystitis. If you don't know what that is, it's burning with urination in your private parts down there constantly, no matter what you do. And it is very, very unpleasant. Imagine a urinary tract infection that never goes away. Dental issues, sinus infections, allergies, autoimmune diseases, ulcerative colitis can help with preconditioning as well. So here we go. Macular degeneration. It's great for both the wet and the dry form. It can stop their progression in 100% of the patients. We've seen eye acuity improve around 60 to 70%. And then how we treat macular degeneration is we do like to use MAH, which is the IV ozone with the blood. And we monitor your visual acuity weekly, and often you will start seeing results after 14 to 20 treatments. Now, just remember, I showed you those slides on how effective the different forms are. In here, I'm saying use MAH, the IV ozone, but that rectal, which you can do at home, is just below that. So if you don't want to go to a clinic, fancy clinic, I actually do rectal insufflation, or you're afraid of needles, or you don't want to have your blood done or any of that, you are still going to get really good treatment with using rectal insufflation for macular degeneration. So for aging and chronic fatigue states, the MAH, intestinal, the sauna, saline 1 to 2 times a week. Usually we start seeing results after 14 treatments. It's very important that, if you remember from the beginning slides, that ozone really is not a standalone therapy. We want to use it with other things. So when we're working on aging and chronic fatigue, we want to attend to your other imbalances, such as hormones, nutrition, toxicities. And then once we get you stabilized and feeling better, we can go down as like a maintenance treatment to 1 treatment every month. So in oncology, we do use ozone for cancer patients, and it selectively increases the antioxidant enzymes that is activating the healthy cells and protecting actually against the side effects of chemoradiation. And if any of you all know, had cancer yourself or any treatment with chemoradiation, or you have a family member, you know that once all that is done and they're blessed and said, you're free and you're cured, there still are a lot of complications that come from having that treatment. So this is going to reduce that. It also increases the chemotherapy, radiation, and the use of vitamin C, its effect by adding that additional oxidative stress. It decreases the cell's resistance to chemotherapy drugs. It induces anti-cancer cytokines. So these TNF, these are things that work in your body that you already have that help work against tumor cells and cancer. And so it's going to enhance those so that it can give your body some ability to fight for itself. It also has been seen to have direct effect on the cancer cells. It can kind of normalize those cells. It stimulates the death of the cancer cells, but also we want you to go get treated. We want you to see oncology. Many of them will work with us in functional medicine, and we do want you to get the chemo, get the radiation, get the things that they're recommending, and we want to support you through that. So I do want to reiterate that we really do not feel that ozone is what you should use by itself for your cancer, unless you have decided that you're not looking for life continuing treatments and that you just want to support the life that you have left, then we can use ozone by itself with the other items. So in acute infections, we often combine it with conventional therapy. We do like to use IV ozone. Often we also like to use sodium ascorbate. That's vitamin C for those of you, and often treat 1 to 2 times per day until the infection is cleared. So chronic infections such as hepatitis, Epstein-Barr, I really, really like ozone for the treatment of EBV and the reduction of symptoms and reduction of the viral load. We often want to combine it with other therapies. The MAH is perfect for this. We can also use intestinal and sauna. Using IV vitamin C following the use of ozone increases its effectiveness on viral things. And then after we kind of get you stabilized, we can lower your treatment times. And those of you who have things like Epstein-Barr, it's kind of sometimes a wax and wane. It gets triggered by things like COVID, stress. And so we can use that as well. Herpes, 1 and 2 infections, super great for that. Best if we treat it daily, usually when the outbreak is happening. And then you can use it once a day for 2 consecutive days every month. And the instances of outbreaks will decrease as you continue to use that. I touched on interstitial cystitis. It can often be cured in a majority of cases when we use this in a combination with an anti-inflammatory solution. So we will often, interstitial cystitis comes from the bladder. If you've ever been to the hospital or you had a baby, you might have had a Foley catheter. That's a tube that we put in your bladder. So what we do is put the tube in your bladder and we will instill a solution that has a numbing medicine as well as a little bit of steroids in there as well. So that's kind of the anti-inflammatory solution. And then we put the ozone gas in and we take the catheter back out. You hold it as long as possible. So in 18 men and women treated, 60% actually had long-term remissions and only 1 failure in the study that I looked at, and no side effects as a result of the ozone treatment for interstitial cystitis. Sinus insufflation. So we're going to squirt that gas up in the nasal passageway. Super great for infections. We have lots of chronic infections and things that get up in there. I see it a lot in my mold and mycotoxin patients. So we can use a 10 to cc syringe filled with ozone gas. We have you take some deep breaths. We want you to hold it. We inject it into each nostril, and then we want you to exhale. So this hits on, oh, I don't know if I want to do this because I heard it's bad for my lungs. That's why we actually have you take that deep breath and hold it so that after we get the ozone gas in your nasal passageway, you are blowing it out. So very, very minimum chance that any of that is going to get into your lungs. And we can repeat that weekly for chronic problems, or we can actually use it daily for any acute infections. So that is the end of my slideshow today. I hope you guys enjoyed it. I am pretty passionate about ozone, and I think that there's a lot of things that we can use in general to help enhance our well-being and the treatment that we have for lots of the conditions that I see you guys in my clinic for. If you have any questions or concerns, feel free to reach out to us. And there's also lots of resources as well on the internet about ozone. And I'll be happy to post some of those at the end of this slide show for you when we get this on YouTube.